Thank you for joining me today for our discussion on health professional student loan repayment programs for Michigan's primary care providers. My name is Rachel Ruddock, and I'm the Recruitment and Retention Services Manager at the Michigan Center for Rural Health. Before I begin speaking about the loan repayment programs that are available for primary care clinicians, I'd like to just briefly discuss the Michigan Center for Rural Health, who we are and what we do. We are a nonprofit organization and the recipient of the State Office of Rural Health grant. As the State Office of Rural Health, we serve as the point of contact for rural health issues and initiatives across Michigan. We also advocate for rural health care and communities and collaborate regularly with the state and federal agencies. We work with EMS, rural health clinics, and hospitals in all 57 rural counties of Michigan. There are 83 counties in the state of Michigan, and the federal government has designated 57 of them as being rural. The purpose of today's discussion or presentation is to talk about the state and federal loan repayment programs that are available. The good news is that there are programs that exist to assist primary care clinicians working in medical, dental, or behavioral health fields who elect to work in a health professional shortage area, a HPSA, in an outpatient setting. Programs are state and federal income tax exempt. That's a very important detail to know. The funds that you would receive either from the federal or state governments would not be subject to income tax, which is a great benefit. For the purpose of these programs, medical primary care is defined as family, internal, OB-GYN, pediatrics, geriatrics, Med-Peds, and psychiatry. And the group of clinicians that are typically included or are eligible for these programs are physicians, dentists, nurse practitioners, certified nurse midwives, physician assistants, psychologists, and licensed clinical social workers. I want to spend a few minutes just talking about health professional shortage areas, or HPSAs. This is a very important term for you to know and to understand because both eligibility for both either the state or federal loan repayment programs requires that you work in a HPSA. So a health professional shortage area, it's a designation and an accompanying score that's given by HRSA at the federal level to counties, populations, or facilities that have a shortage of providers. And this is a shortage of medical, dental, or mental behavioral health providers. The scores that accompany a designation are on a scale of 0 to 26. A higher score indicates a greater need. And as I mentioned, both federal and state loan repayment programs use HPSA to determine qualification for loan repayment. So probably your next question is, well, how do I know if where I live or where I'm working has a HPSA designation and score? You can go to this website and find HPSA designations and scores at hpsafind.hrsa.gov. Go to the website, select Michigan, and then it will populate all 83 counties in the state. So you select what county you're interested in working in. And then check if you're in the medical field, you check the medical box that's right underneath it and hit search. And that will populate all HPSA designations along with their scores for that county. And that will give you an idea of where the HPSAs are located. Some counties in Michigan have an entire designation, the entire county has a designation, but then there are other places within the state where maybe a town has a designation or a certain clinic, such as a rural health clinic or a federally qualified health center. So it's very important if you're interested in these loan repayment programs to start taking a look at this website to get an idea as to really where the HPSA designations are in the state of Michigan, which would tell you where you would need to work in order to be eligible for the loan repayment programs. So for these loan repayment programs, you can apply for these programs really after three things have occurred. After you graduate from your program, from receiving your education, you become licensed. So whatever the licensing requirement is for your profession, you need to become licensed, and you need to obtain a job in a health professional shortage area in a HPSA, as we just discussed. So those three things need to occur first prior to you being eligible and applying for the loan repayment programs. In addition, I want to touch on the issue of qualifying debt for a few minutes. So the government says that in order to participate in loan repayment programs, either the state or federal programs, you need to have either government or commercial private student loans for undergraduate or graduate education that was obtained for tuition, other reasonable educational expenses, and reasonable living expenses. Mortgages, car loans, credit card debt do not count as qualifying debt, or money that you owe to mom and dad or owe to other family members. Sometimes I see arrangements such as mom and dad have taken out a mortgage or taken out a loan to pay for someone's education, pay for their children's education. And I'm often asked, is it possible to participate in this program and then just, rather than paying a loan provider back, pay mom and dad back? And unfortunately, that is not possible. You need to have, these loans need to be either through the federal government or they need to be through private commercial lenders with proper documentation to be able to prove to the state or federal government that when they hand you a check for up to $25,000 per year in loan repayment, that you are taking that money and putting it on your loans. It's also important to note that if you are thinking about debt consolidation, I would just encourage you to do your research, think about it thoroughly prior to doing so if you are interested in participating in one of the loan repayment programs. Sometimes people will take educational debt, which is qualifying debt, and they will merge it with non-qualifying debt such as credit cards or car loans because it may be more convenient. You'd have one payment versus two, or a lower interest rate. However, if you merge qualifying debt with non-qualifying debt, you have now made all of that debt non-qualifying in the eyes of the government. And they will not take the time to listen or to figure out what amount of debt went towards school and what amount of debts towards credit cards or whatever the situation may be. They will not take the time to figure that out. They will just say that you have now made all of that qualifying debt non-qualifying. So I would highly encourage you, really think about it before you consolidate if you are interested in these programs. So now, to jump into the meat, so to speak, of the loan repayment programs, this overview I'm going to give of the National Health Service Corps and the Michigan State Loan Repayment Program is just that. It's an overview. These programs are very detailed and go much further in depth, but for the sake of your time, I'm just going to give you the key basics that you need to know. However, I would highly encourage you, if you have an interest in these programs, to take some time to look at the websites for these programs and really get to understand and know these programs better. And I will, at the end of this presentation, I will give you those website addresses for you to be able to take a further look and do some further research. So the National Health Service Corps Loan Repayment Program. This is a federal program provided to primary care clinicians in full-time outpatient primary care practice. So those are some three key points there. You must work in primary care. You must, there's a full-time, there is a part-time option as well. However, I will say that part-time providers are not as highly prioritized as full-time providers. So I would encourage anyone who is interested in this program to consider working full-time because you will be higher prioritized for loan repayment versus a part-time employee. And you need to work in primary care practice. So as we discussed earlier, you need to work in family, internal, peds, OB-GYN, Med-Peds, Geriatrics, Psychiatry. You need to work in one of those fields in order to be eligible. You must work in a HPSA area, so such as a county or a town or a facility such as a rural health clinic or a FQHC, with a minimum score of a 14 or above in order to be a competitive applicant. So think back to when I first discussed HPSA and I said that it's on a scale of, the scores are on a scale of a 0 to 26. That means that for the National Health Service Corps, you must work in a HPSA, as we know, but not only work in a HPSA, but the HPSA that you are working at must have a score of a 14 to a 26. If you, say, work at a rural health clinic with a HPSA that has a score of an 8, the National Health Service Corps is not going to be the loan repayment program that you're going to want to look at. You're going to want to look at the Michigan State Loan Repayment Program. And when I get to that slide next, you'll see why. But if you do not work in a HPSA with a score of a 14 or above, I would not encourage you to apply to this program because more than likely you will be denied. It's a pretty it's pretty given that you need to have a 14 or above. Applicants with HPSA scores lower than that are more than likely not going to be awarded loan repayment through the National Health Service Corps. You must be a U.S. citizen or national, and you can receive up to $25,000 per year or up to $200,000 over the course of 8 years. As I mentioned, this program, if you're interested in working in rural Michigan or already work in rural Michigan, typically this program is not an option for Michigan's rural providers because our rural areas, the vast majority of them, do not have HPSA scores above a 14. But if you find yourself in that situation, don't become discouraged because the door to loan repayment has not shut. You are just going to want to focus your attention on the State Loan Repayment Program. So moving on to the Michigan State Loan Repayment Program. This program is state-appropriated dollars that are provided to primary care clinicians in full-time outpatient primary care practice. There is no part-time option for the State of Michigan program. You must work 40 hours per week, minimum, full-time. The emphasis is placed on the HPSA designation, not the score. And this is the first key difference between the state loan repayment and the federal loan repayment programs. The state of Michigan, this is where, say you work at a rural health clinic that does have a HPSA designation, but they only have a score of an 8. This is why the state loan repayment program is going to be your option or going to be the program that you are going to want to apply to. Because the state of Michigan says, we don't care if you work at a rural health clinic with a HPSA score of an 8 or you work at a federally qualified health center with a HPSA score of a 20. We don't care about the score. We just care that you are working in a health professional shortage area. So that is where the emphasis is placed. Another key difference is that the Michigan State Loan Repayment Program requires your employer to contribute a 20% match for each year that you participate in the program. So what that means is that say you receive the maximum amount of loan repayment per year, which is $25,000 per year. Your employer is required to contribute 20% of that $25,000. So 20% of $25,000 is $5,000. So your employer would contribute $5,000. The state of Michigan would contribute $20,000 to total $25,000. The same applies regardless of the amount. So if you're receiving $10,000 or $15,000 per year in loan repayment, your employer has to contribute 20% of that. They have to do this for every year in which you participate in the program, so potentially for up to 8 years. At the National Health Service Corps at the federal level, the federal government does not require your employer to contribute or to provide a match. But the state of Michigan does require that, and your employer will never be able to get out of that, so to speak. That is a strict requirement. The employer contribution is there and will always be there. You must also, again, be a U.S. citizen or national to participate in the state loan repayment. You can receive up to $25,000 per year, over $200,000 over the course of 8 years. And starting this year, the State Loan Repayment Program decided to use a new calculation to determine funding. So, for example, say you have $50,000 in student loan debt. That will be divided by 8 because you can participate in the program for up to 8 years, and be multiplied by 2. And that total will be the maximum yearly award amount that you can receive. So in this case, if you had $50,000 in student loans, you would receive roughly, the maximum you could receive or request would be $12,500 per year. And so however the math works out for you based on how much you have in student loans. That's why this is also a good time, if you're interested in these programs, to sit down and start adding up between undergraduate and graduate school what your total is in student loans, because then you can apply this formula to figure out for the State Loan Repayment Program how much you could receive per year in loan repayment. The application cycle for the state of Michigan is January through April. However, the applications are batched at the end of every month in the application cycle. And so you are going to, if you want to have the best shot and the best opportunity at receiving loan repayment, you are going to want to have that application in January. What the state of Michigan does is throughout the application cycle, at the end of every month, they sit down and they review all the applications that arrived. So, for instance, in January, they sit down and they go through in the order in which they were postmarked and received. They sit down and they start reviewing all the applications that arrived in January, and they start making funding determinations then. So money is already being distributed, so to speak, or being obligated in January. It's essentially rolling admissions. So you do not want to be someone who waits until April to submit your application, because that's going to mean that the likelihood that the funds are all obligated by April is going to be very high. You're going to have a low chance at receiving loan repayment if you wait to apply until April. This program does not reward procrastinators. If you are a procrastinator, do everything in your power to stop that and to work ahead of time and to be able to submit your application in January. I should also note that completing this application is not a quick process. It's not an electronic sit down one evening, go online, submit the application. It's all done via paper. There are forms that you have to download, print off from the State Loan Repayment website. You as the employee or as the loan award recipient will have to fill out a form. Your employer will have to fill out a form, and then your loan providers have to fill out a form. And the loan provider form is often one where applicants find their application being held up because their loan servicers don't fill out the form quickly and return it back to the applicant. So I would highly encourage you, usually the state of Michigan posts these forms usually around sometime between Halloween and mid-November, prior to the January 1st application cycle starting. So I would highly encourage you around Halloween to start checking the State Loan Repayment website on a regular basis to see if they have posted the new application materials. And once they have, print those off and start working on them. Get them to your loan servicer, get them to your employer. You start filling them out. Especially that time of year is also the holidays and a lot of vacations and time off for a lot of people. Do everything you can to have that application completed and filled out and ready to go, and mail it all in one package on January 1st. Just put it in the mail. That's your best opportunity to be able to be a competitive applicant for this program and to receive loan repayment. That's the best you can do to pretty much guarantee yourself loan repayment. So now switching gears a little bit from talking about the loan repayment programs, as I mentioned, you need to first have a job. You need to first have a job in a primary care outpatient position in a HPSA. So how do you go about when you're finishing school, you're getting licensed, you need a job? Where do you start looking for a job, or how do you find a job? One place that you can look, if you are interested in working in rural Michigan or rural America, you can take a look at the National Rural Recruitment and Retention Network, 3rnet.org. It's my office, the Center for Rural Health, is the organizational member for Michigan, and our focus is solely on the recruitment efforts of rural facilities and candidates who want to work in rural areas. It's a free resource. It costs nothing for hospitals or health systems to post positions on there, and it doesn't cost anything for a job seeker to search and take a look for positions. I would highly encourage you, even if you are not necessarily interested in working in rural, to still take a look at the website, to still sign up, and it's a great opportunity to look and see what the health systems and the hospitals and the clinics throughout Michigan, what they are looking for in employees. A lot of them will post the benefits that they offer. Some may post the compensation. They'll post the types of positions that they have open, the communities that these positions are located in. There's a lot of very good detail on there, and it just will give you a good idea as to the type of jobs that are out there and what employers and what hospitals and health systems are looking for. When it comes to planning for your career, I'm often asked, well, how soon should I start looking for a job? You know, if I'm a nurse practitioner or physician assistant, I'm already finished with 1 year of school, should I start looking for a job? Or I'm in my first semester, should I start looking for a job? Or I'm a medical student and I don't know when I should start, thinking about looking for a job. Obviously, I have residency to complete, but really, when do I start doing all of this? And my advice is always that it is never too early to start. It's never too early to start, like I said, taking a look at 3rnet or other job board websites, learning more about the various health systems throughout Michigan, various hospitals or independent hospitals or the clinics or whatever is available. It's never too early to just start looking through all of that. If you do any clinicals or preceptorships or clerkships, that's a great opportunity. Use that time to also really evaluate, do I like working here? Do I like the location of this job? Do I like the people in this health system? Do I like the rules and the policies of this health system? Or is this really not for me? Really use those experiences to evaluate what you like and what you dislike. Network, network, network. I'm sure you've heard this before, but I'm going to reiterate it again. You have to network. I would tell anyone and everyone that you know that you are looking for a job. Hi, my name is Rachel. I'm a physician assistant. I'm graduating, in August. I'm looking for a position. Tell everyone you know that you are looking for a job. They may not be in the healthcare field. They may not be a physician or nurse practitioner or physician assistant, but you never know who they may know. Their brother or sister or spouse or neighbor or cousin. You don't know what their network is, but they won't know that you are looking for a job or that you are looking for opportunities unless you tell them. So definitely network with anyone and everyone. It can only help you. It will not harm you. And it's a good skill to have just as you move throughout life. Most people are not going to stay at one job for their entire career. So you need to constantly be networking and thinking about that next move. Where are you going to go and how are you going to get there? Stay up to date on the business side of medicine, which this is more important than ever. As we know, things are rapidly changing in the field of medicine. There's new initiatives and requirements, and it's only going to keep increasing. So this is very important for you to have a general grasp on it, though. I'm not saying you need to go get an MBA and become the equivalent of a chief financial officer, but you certainly need to understand how this is going to affect you, because these things are ultimately, these changes are going to affect how you are compensated. They're going to affect your how productive you have to be, your productivity levels. It's going to affect your scope of practice, how you're able to run your practice, what you're able to do. And those things are very personal. Obviously, what you're paid, what you're told you have to do, changing your job or changing the way in which you do your job, those are very personal things that will affect you, and you will obviously feel that change. So you need to be aware of what is going on out there so that you can adjust accordingly and figure out what is a good fit for you. Attend conferences, professional networking events, see if your local community has a networking event. It doesn't have to be healthcare related, but just a local networking group, or a monthly get together at a local bar or brewery or whatever it may be. But try to attend some of those events and get to know some of those people. And then if you haven't done so already, establish your personal and professional priorities. Do you have a family? Do you have a spouse? Do you have a partner? Do you have, needs, that family, personal needs that keep you in a certain geographic area? Or are you able to go wherever you want to go, or wherever the best opportunity is for you? What are your professional needs? What type of practice do you like? Do you want to work in an employed practice and not really have to worry about the whole business side of things and let someone else who works for the health system take care of that? Or do you want to be a solo practitioner and run everything on your own and be employed for yourself? Or are you interested in being a hospitalist, working in a hospital? Or do you want to strictly work in outpatient clinics and primary care? There's a lot of variety and a lot of options out there, but you really need to establish what you like and what you dislike. Finally, this is just a slide with some of the resources, the websites that I mentioned in this presentation. So the Michigan Center for Rural Health, the National Health Service Corps, the Michigan State Loan Repayment Program. And those two websites I would highly encourage you to take a look at, learn more about the National Health Service Corps and the Michigan State Loan Repayment Program. 3RNet. And the HPSA Find website, where you can look up and find HPSA designations and scores all throughout the United States. As always, feel free to contact me with any questions about anything that was mentioned in this presentation. I'm always available to assist, and feel free to give me a call or send me an email. Email is usually best, as I'm on the road quite often, and so email is just easier to get in touch with me sometimes, but feel free to contact me either way. And if I am unable to provide an answer to you, I have a great network of people around me who I can reach out to, and we can find an answer to your question. So thank you so much today for taking time to listen to this presentation on health professional student loan repayment programs. And again, if you have any questions, feel free to reach out to me at the contact information on these slides. Thank you so much. Have a great day.